Hello, I'm State Senator Josh Newman, and I have the privilege of representing Orange County in the California State Senate. As your representative, I'm very proud to be able to support the work of the Orange County Aging Services Collaborative toward implementing and advancing the Master Plan for Aging in Orange County. California is in the midst of an unprecedented demographic transformation, with the state's 60 and over population estimated to reach 10.8 million by 2030. Nearly 500,000 older adults call Orange County home today, and this steadily expanding demographic is expected to comprise 25% of the county's overall population in the coming decades. In 2019, Governor Gavin Newsom issued an executive order calling for the creation of a comprehensive master plan for aging. The executive order affirmed the health and well-being of older Californians as a key priority and emphasized the need for policies to promote healthy aging and the development of a comprehensive framework of service delivery for supporting the aging population. The MPA, as it is referred to, established 5 discrete goals: housing for all stages and ages, health reimagined, inclusion and equity, not isolation, caregiving that works, and affording aging. In support of these goals, and consistent with its leadership role in so many important areas, Orange County has already begun establishing a model for senior care worthy of replication across the state. I want to personally say thank you to all of the participating agencies and organizations, as well as to all of the caregivers and community members in attendance today. While there is clearly a great deal of work to be done, you're all to be commended for your generous commitment and active participation in this important effort, which will crucially assist in the development of age-friendly communities for all Californians. Thank you.
Good morning, and welcome to Orange County Aging Service Collaborative's Mastering the Master Plan event. I'm State Senator Dave Min, and I have the privilege of representing Irvine, Laguna Woods, Orange, Huntington Beach, Newport Beach, Laguna Beach, Lake Forest, Tustin, and several other communities in the heart of Orange County. While California is a relatively younger state compared to the rest of the United States, we are aging quickly, and our 55-plus population will increase by nearly 4 million people over the next 40 years. And unlike much of the rest of the United States, we have a diversity in our senior population that closely reflects the diversity we see in California generally. That means that our seniors face unique challenges and means that we need strong partnerships at every level to ensure that all Californians are valued and afforded opportunities to thrive as we age. As you all live through your golden years, we, who are the policymakers of the state, have a responsibility to make sure that those golden years are ones that are lived with dignity, with the services that you need. And so the Master Plan on Aging is so important because this is an effort to do just that. Master Plan seeks to address important issues that face aging Californians, including housing insecurity, improving access to health care, protecting seniors from abuse and fraud and isolation, supporting caregivers, and ensuring that elders are economically sufficient. The work that this particular effort is doing on behalf of Californians will improve the lives of so many, and I appreciate the dedication of those here today. While I can't be with you in person, I am 100% in support of these efforts and look forward to partnering with the OC Aging Service Collaborative in the state legislature. Thank you so much.
Hello everyone, I am Assemblyman Tri Ta. Which Orange County population rapidly aging. Now is the right time to talk about State Master Plan for Aging. As the Vice Chair of the Assembly Committee on Aging and Long-Term Care, I am grateful to all the stakeholders for coming together to discuss and share ideas on what we can do to improve the Master Plan. Included in the Master Plan 10 Years Blueprint, there are proposals to promote healthy aging, improving access to healthcare services, supporting people living with disability, and how to care for our diverse senior population. Congratulations to Orange County Aging Services Collaborative on their effort to bring together everyone to promote the Master Plan on Aging and discuss the future of aging. Thank you so much for allowing me to be the part of this excellent event.
Good morning. I'm Senator Alex Padilla, and it's my pleasure to join all of you as you hear about how Orange County is preparing to support an aging population for years to come. Orange County is a fantastic place to live, to work, to play, and to retire, with plenty of resources and support for older Americans. But as the OC community and our nation as a whole continues to age, we need to make investments today that will support an aging population in the years ahead. That means expanding access to health services, increasing our caregiving workforce, protecting the economic security of our seniors, and more. Today, you'll hear from elected officials and from Orange County's leadership on aging about how the county plans to implement California's Master Plan for Aging. I hope that today you engage with these local leaders, you learn more about California's Master Plan, and that you can take away some sense of comfort in knowing what's ahead. Thank you to the OC Aging Services Collaborative and to all the folks who made today's event possible. And I certainly hope to see you soon.
Hi everyone, I'm Vicente Sarmiento, Orange County Supervisor for the 2nd District. Orange County is a great place to live and retire, with plenty of resources and support for our older adults, but we need to prepare for the growth of our aging population. In just a few decades, 25% of the residents of Orange County will be over 65 years of age. That means 1 in 4 of us. Orange County is working to address and prepare a response to the California Master Plan for Aging. The Master Plan outlines bold goals and strategies for leaders in government, business, philanthropy, and community-based organizations to collaborate on creating age-friendly communities for all Californians. This Master Plan for Aging includes a 10-year blueprint for promoting healthy aging, including bold proposals for building housing for all ages, improving access to health services, providing inclusive opportunities for seniors to live and work without fear of abuse and neglect, bolstering the caregiving workforce, and increasing economic security for aging Californians. The Master Plan includes new methods of supporting older adults, people with disabilities, and diverse ethnic communities. California's senior population is becoming more ethnically diverse, more likely to be single or childless, live alone, work longer, and have lower incomes than in past decades. I'm thankful to the Orange County Aging Services Collaborative for their efforts to gather input from our community partners and assistance in crafting our local blueprint to the future of aging in Orange County. Thank you for all your hard work.
Good morning. Welcome to the Orange County Aging Services Collaborative's Mastering the Master Plan webinar. We're so pleased that you've joined us this morning. My name is Patty Mouton. I serve as Vice President at Alzheimer's Orange County, specializing in outreach and advocacy, and I chair the Public Policy Committee for the Orange County Aging Services Collaborative. So on behalf of all of the member organizations, we welcome you to this really exciting update on what's happening here in California, and particularly here in Orange County for the Master Plan for Aging. Little bit of housekeeping. You'll be able to ask questions and mark those questions through the Q&A function at the bottom of your screen. Your chat is disabled and attendees are in listen-only mode. The webinar is being recorded and you will have an opportunity to view it at a later date, but we want you to be aware that your questions and all of the presentations and videos from our elected officials will be recorded. Here's our agenda for the day. Our first speaker will be Dr. Jackie Tompkins from the Department of Aging, Jim McAleer, the President and CEO of Alzheimer's Orange County and founder of the Orange County Aging Services Collaborative. We have Claudia Harris, the Director of the Orange County Office on Aging, and Katie Calvoda, the President of Advance OC, our data collection arm of the response to the Master Plan for Aging here in Orange County. We'll take a little break around 10:30, and then we'll start the town hall portion. And many of you have submitted questions previously for our panelists, and they will answer those questions first, moderated by Jack Light, the director of the Orange County Caregiver Resource Center, and I'm now in leadership of the Orange County Aging Services Collaborative. So we'll start this morning with our keynote speaker. Dr. Jacqueline Tompkins is a senior strategist for California's Master Plan for Aging at the California Department of Aging. She leads the Master Plan for Aging's local engagement activities. She is active in the Aging and Disability Action Planning Grant Program, providing support for monitoring the committee. And prior to being with the California Department of Aging, Jackie worked at the California Department, of Public Health for over 15 years. She's held a variety of positions in the areas of chronic disease, obesity prevention, nutrition education, and substance abuse and addiction treatment. With a background in kinesiology, gerontology, and public health, and a stalwart commitment to delivering public service through an equity lens, Jackie earned her PhD in public administration with a dissertation focused on building a disability-competent public health workforce. We welcome Dr. Jackie Tompkins, and she's going to give us an update on what's happening statewide for the Master Plan for Aging. Welcome, Dr. Tompkins.
Good morning. Thank you for that warm welcome. I'm confirming that you all can hear me okay and my screen is showing.
Yes, it looks fine.
Fantastic. Thank you. So again, my name is Jackie Tompkins. I work here at the California Department of Aging, specifically working internally within our department, as well as externally with our sister departments, agencies, and the administration to advance our state's Master Plan for Aging. The Master Plan for Aging really is a bold and strategic plan aimed at building communities and systems and policies for all ages and all abilities through multi-sector partnerships and person-centered investments. As you heard earlier, the increasing demographics within California as it relates to older adults is increasing, and it's changing the way that we need to prepare ourselves to deliver services and programs that are, again, person-centered and really being responsive to the changing demographics here in California. California's older adult population is growing faster than any other age group. And you heard earlier, by 2030, nearly 11 million Californians will be an older adult within the state. And that's about 1/4 of our state's population. On this next slide, I simply wanted to illustrate that these increases in the numbers as well as the diversity of California's older adult population is seen across every region of our state. So you can see here for Orange County, the percent increase from 1980 to 2060 in terms of the projections for this particular age group. So your community can prepare to be home to nearly 1 million older adults come 2060. And definitely this growth in sheer numbers of older adult populations, as well as the diversity, presents challenges, but it also presents us opportunities that really requires us to do proactive thinking, planning, and action. And that's essentially where our state's Master Plan for Aging comes in. The development and outcome of having a Master Plan for Aging within California reflects several milestones that have been going on for decades and beyond. Essentially on this slide, I'd just like to highlight Governor Newsom's executive order, which called upon our own California Health and Human Services Agency to create a cabinet level work group on aging to advise the development and release of a Master Plan for Aging. We also have the California Department of Aging, which is a lead convener in steering the Master Plan for Aging. But please know that the Master Plan for Aging is really a whole of government approach and requires us to have leadership at the administration level, agency level, as well as across our departments. sharing on this slide that the Master Plan for Aging was released in January of 2021. So the master plan is nearly 3 years old. In fact, we are working on our 3rd annual report. On an annual basis, we do report out on the status of the Master Plan for Aging to keep partners, stakeholders, legislatures, and others aware of the progress that's being made on the state's Master Plan for Aging. The MPA has 5 bold goals, and these goals are designed to drive us to 2030 to really keep us focused and strategic. These goals focus on housing and community, healthcare, inclusion and equity, caregiving in our workforce, as well as affordable aging. And what I really appreciate about our state's Master Plan for Aging is it really looks at what are the current needs of older adults, people with disabilities, as well as caregivers, but it also looks at what are the emerging needs, what are the future needs of this population, and really provides that blueprint of how multi-sector partners in housing, in transportation, healthcare, social, behavioral health can rally together, develop strategies and initiatives to achieve these goals. So while we have these 5 bold goals, we also have 23 strategies that support these goals. And further, we have initiatives that further support the strategies and the goals. The initiatives within the California Master Plan for Aging get updated on every 2 years. So again, while the goals do not change and the strategies do not change, it's really important that we're able to stay responsive, nimble, and flexible by having initiatives that can evolve, be redefined, or continued. I do want to recognize that within California, the desire and interest of creating age and disability friendly communities definitely extends beyond our state level and is supported by local leaders, including here in Orange County. In 2021, California actually became the 8th state in the nation to be a member of AARP's Network for Age-Friendly Communities and States. And across our state, we have a number of communities that also belong to this network that have made a commitment to work with communities to develop a plan, and not only develop a plan, implement that plan and move forward into continuous quality improvement to revise, revamp, and redefine their plan as needed. Across our state, numerous communities are at various stages of implementing their own local master plans for aging and disability. We have 3 counties as of our data last year that are really in that implementation stage, and we have about 29 counties that are in that planning and development stage. We annually reach out to our county partners to get updated numbers on the status of where they are in implementing their own master plans for aging. So just want to again thank the leadership here in Orange County who have clearly demonstrated that preparing for their older adult population, people with disabilities, and caregivers are a priority for your community. The California Department of Aging is also supporting this work. Some communities have been able to work on developing their own local plans through other funding and services and resources. However, the California Department of Aging was graciously awarded $4.5 million to allow us to award one-time funding through competitive grants to support other communities within our state to develop their own aging and disability friendly action plans, very similar to the state's master plan process, in which we're asking communities to do community needs assessment, working with the diverse populations to hear different perspectives and views on what's working well, what resources and services are needed. And so our funding really is grounded in equity. We want to support communities that have been historically under-resourced or underserved. We were able to successfully award 15 grantees when we initially released our RFA in February of this year. And currently we will be able to release or announce another set of awardees this month. So looking forward to working with additional communities within California. As I shared with you, the MPA is a living document. It's not designed to be static, sit on a shelf. It's really designed to be dynamic, responsive, and flexible. And again, that structure of the plan in which we have the goals, the strategies, and initiatives that evolve every 2 years allows us to do that. And again, while the coordination and administration of the master plan is housed at the California Department of Aging, we work with numerous partners, whether that's at healthcare services, social services, developmental disabilities, Department of Rehab, to help us administer and implement the state's master plan for aging and produce outcomes. On this slide, I know it's a little bit busy, but right now we have over 90 active initiatives for 2023 to 2024. And so I picked out a few that I thought would be of interest to this group that not only is CDA involved in, but we also partner with some of our other departments and agencies on. So these topics are definitely cross-cutting and require multi-sector partnerships. So you can see here, we're really looking at evaluating options for long-term services and supports. We want to have a better understanding of the services and gaps in home and community-based services. So doing an analysis around that, as well as producing a roadmap. We are partnering with agencies to expand evidence-based behavioral health programs across the state. We're looking at improving dementia assessment through the Dementia Care Aware program. And we're also going to be releasing shortly a survey designed for LGBTQ plus older adults and learn about their specific needs and recommendations for services and resources. We also acknowledge that older adults, caregivers, and people with disabilities really need to have supports that are easy to locate and that they're familiar with what's available in their community. So California Department of Aging is also working on establishing a California's No Wrong Door system, as well as a leadership council to make it easier for the consumer, the public, the older adult, the person with the disability, and their caregivers to again understand what resources are available in their community and have access to such resources. And earlier this year, CDA did release its first ever statewide baseline consumer satisfaction survey, which is really going to help us revise, revamp, and enhance the aging network here within California. So again, with over 90 initiatives, definitely can't put that on one slide, but just wanted to show you a sampling of the collection of work that's being done at the California Department of Aging in partnership through the Master Plan for Aging. Let's talk a little bit about the results. The MPA is really driving results here in California. So on the next couple of slides, I'm going to take a look at each goal area and share with you just some highlights of what has been accomplished within this state, within our state to enhance that understanding. So under our goal 1, which is focused on our housing and community, there's been efforts to build capacity for housing and services to prevent older adult homelessness. And this is done through a program through our Department of Social Services called Community Care Expansion. Again, this is just a sampling for the purposes of today's presentation. Under goal 2, which focuses on healthcare, we're working with partners to expand healthcare access, affordability, and also investing in home and community-based services with that gap analysis and roadmap, and also working on investing in our Alzheimer's early intervention supports. Within goal 3, which is focused on inclusion and equity, not isolation, there's a number of successes under this bucket area. A few to highlight include providing digital technology to older adults and people with disabilities to bridge that digital divide. This also includes enhancing our aging and disability resource connection centers. And also recently, California Department of Aging has been awarded $15 million to help enhance and boost our own behavioral health programs, services, and health communications campaigns to elevate the importance of behavioral health within the older adult population. So we're incredibly proud to have this investment and look forward to working with communities to implement the grant programs that would be awarded under this $50 million. We also have under our Caregiving That Works, we understand that workforce that supports older adults and people with disabilities is incredibly important and essentially is the backbone. I'm a caregiver myself for my son who has a developmental disability, so I definitely know firsthand the challenges of being a caregiver, as well as the beauty and the benefits and the wonderful joys that we get out of being a caregiver. But it's also important that we recognize that caregivers need support. They need support, resources to help them care for the individual that they're caring for. And so there's been resources and investments made in our in-home supportive services workers, IHSS workers, as well as here at the California Department of Aging, we administer the CalGROWS program. And then finally, under affordable aging, we have had record investments in nutrition education by expanding our CalFresh program, improving home delivered meals, enhancing congregate dining options, and improving the infrastructure to really support more meal options, preparations, and delivery. So all in all, sharing this is an exciting number that here within California, if we look at the investments that have been made to support the Master Plan for Aging, it really totals $9.5 billion of investments across the 5 bold goal areas. While the Master Plan for Aging definitely supports new programs, what I also like to say is that the Master Plan for Aging is also an opportunity for us to leverage existing programs and services and think about how we can do them better, how we can integrate, coordinate, and improve the services. So it's not always about new, but it's how we can enhance existing. Sharing on this next slide that the development of the Master Plan for Aging here in California and its continued implementation is really driven by MPA stakeholders. Even before the MPA was developed, there were numerous work groups and stakeholders providing input and feedback on what should be those 5 bold goals, what should be those 23 strategies, what should California be focusing on. And it continues again to be the backbone of the success that we have within here in California to advance and elevate the MPA. What I'm sharing here is that we have a number of MPA stakeholder committees. This includes committees that are focused on Alzheimer's disease, elder and disability justice, disability and aging and community living. That's the committee that I help to support. We have an equity committee and a research committee. There are a number of subject matter experts, whether it's through education, experience, or being a consumer. And we love to hear the diverse voices that individuals on these work groups bring to the California Department of Aging and beyond. I want to share with you that these committees, they meet, depending on the committee itself, maybe 3 to 4 times a year virtually. And even if you are not a member of the specific committee, the committees that you're seeing here are open to the public. So you are more than welcome to join a committee meeting virtually and provide any public comment during the designated times. So that might be of interest to some of you on this call, is learning more about these specific committees. We'll also share with you that the California Department of Aging is active on California's Interagency Council on Homelessness, as well as our state's Behavioral Health Task Force. A couple of final slides is looking at just the accountability in advancing our state's Master Plan for Aging. Last year, in addition to releasing an annual report to the legislature, the public, as well as our stakeholders, we also have an online dashboard. We call it our MPA Implementation Tracker. And this is publicly available. So at any moment, we typically update this a couple of times a year. We reach out to our partners to ask for initiative updates, because again, a lot of the initiatives within the Master Plan for Aging are maybe led by another department aside from CDA, or it might be an initiative that's led by multiple departments and agencies. So on a biannual basis, we reach out to our partners and talk a little bit about the progress of the initiative to ensure that accountability. So you are more than welcome to search a specific goal area, specific strategy, or area of interest and learn about what is the current status of this particular project. So wanted to make sure that you're aware of that resource. In closing, I wanted to share with you that creating master plans for aging is really gaining momentum across our nation, and California is leading the way. There are about 26 other states across California that are seeking to implement master plans for aging, and California is frequently called upon to share our successes, our lessons learned, best practices. So I'm incredibly proud to be a part of the team that's helping to support the master plan for aging, as well as a resident of California myself. It's really exciting that we have this plan to support our entire state. Again, not only for current older adults, but also preparing for the older adult population that we're going to see here in California. So I very much thank you for your time this morning. I will be on the duration of the time and happy to answer any questions that I'm able to, as well as I'm excited to hear about what's happening in Orange County. So thank you to the coordinators, Patty, and others for allowing me to share a little bit about our state's master plan for aging. Thank you.
Wonderful. Thank you so much, Dr. Tompkins. We so appreciate that statewide perspective from the California Department of Aging. And for those of you that have submitted questions, they will be addressed as we get to the Q&A town hall portion of the event after our break. Next up, we have Jim McAleer. Jim is the president and CEO of Alzheimer's Orange County and the founder of the Orange County Aging Services Collaborative. Jim is among the fiercest of advocates for Orange County's older adults. And as a community leader, he has really helped to create the county's network of resources that have made a real difference in improving the lives of people who are aging and their caregivers. He began his career in the nonprofit world at age 18, pursuing an undergraduate degree in Savannah, Georgia. And for the next 22 years, he worked with individuals with intellectual disabilities, issues of mental health, and other challenges. He earned a master's degree in public administration at Northeastern University in 1994. He relocated to Southern California and began a comprehensive nonprofit consulting business specializing in organizational leadership, management transitions, strategic planning, and fundraising. He's served dozens of clients, including the Friends of Alfaro, the Street Poets, the Crystal Cove Alliance, and many more. Since 2004, he's been in leadership as president of Alzheimer's Orange County. We are an Irvine-based not-for-profit that's been serving people in Orange County at risk for or having dementia for over 40 years. Under Jim's leadership, Alzheimer's Orange County now operates 2 adult day healthcare centers, the Healthy Aging Center at Acacia and the Healthy Aging Center in Laguna Woods. And he's given more than 100 professional presentations, served on 5 nonprofit board of directors, supported at-risk children's causes, and has served on the board of directors for CalOptima. He created the Orange County Aging Services Collaborative in 2009, and it now gathers more than 40 not-for-profit agencies serving seniors for regular collaborative projects and promotion and collective advocacy. He continues to co-chair that group with Jack Light. In 2016, Jim began to convene the Orange County Strategic Plan on Aging, lovingly known as the OC SPA. It consists of organizations and 30 cities in Orange County that support an older adult data report that is released on an annual basis. And he currently serves as chair of that group. We welcome Jim McAleer.
Thank you, Patty. We definitely need to pare down that rather lengthy bio, but thank you. So there's a bit of noise outside of my office. I believe it will resolve itself in a few minutes. So my apologies for the background noise. Let me call up our fun slides here. My apologies. So, as Patty mentioned, the Orange County Aging Services Collaborative is a wonderful gathering of quite a few organizations in Orange County. We began in 2009, and our point was really to see how organizations that serve a significant number of seniors, and some who only serve seniors, how they could work better together, what we could learn from each other. Over the years of our existence, that group has grown to now 40 members strong. They all serve a significant population of Orange County seniors. And one of the things I'm proudest of our group is the level of diversity, gender diversity, ethnic diversity, faith diversity, disabling conditions. It is a remarkably diverse group representing Orange County seniors. Which doesn't seem to want to progress to the next slide.
There we go.
Thank you. So our current activities, we have a number of subgroups that report up to the main group, and they somewhat mirror the state master plan for aging in their activities. So for example, we have the Elder Abuse Awareness Prevention Committee. They coordinate WEAD, the World Elder Abuse Awareness Day. Right now, they're looking for a CU provider to broaden their scope and reach of the audience for that particular day. A very powerful event. The Food Security and Nutrition Subcommittee works to increase food security for Orange County's older adults by enrolling 2,000 new participants in CalFresh over 24 months. They increase awareness about senior food programs, presenting to over 1,000 seniors over a course of 24 months. And they translate senior food help, their presentations and handouts into Spanish and Vietnamese. Our Housing Subcommittee is working to advocate and educate community groups dedicated to issues of housing in Orange County in order to raise awareness and optimize participation in crafting solutions. We have members of OCAST serving on all these committees, and we have people who are not members of OCAST serving on the subcommittees. Next slide, please. Thank you. OCHI, the Orange County Healthy Aging Index, and OCAST, the Health and Wellness Committee, works to increase awareness and access to COVID-19 information. We promote the Office on Aging COVID-19 Toolkit. And I'll pause here for 1 second. One of the things this group is very, very good at is not reinventing wheels. If one of our members has good information, the group will use that information for the benefit of everyone. And people are quite generous about sharing their materials and information. Collateral material information dissemination so that people have as much information as possible. And older adult vaccine and booster distribution information. I think we all know how important that is in this day and age. They increase awareness and utilization of Medicare preventive services for older adults by promoting the updated OCHI Annual Wellness Visit Toolkit to providers who serve older adults. They promote and market the Medicare Annual Wellness Visit with OC older adults. As you probably know, that visit is a part of Medicare and oftentimes is not as comprehensive as one might hope. For example, memory screening might not be conducted. So what this group has done quite effectively is they've reached out to physicians and people who would be patients to make sure they understand what the visit is and what it should and could entail. They promote 20 outreach and education events supporting preventative services, including culturally competent presentations, advertisement, and information dissemination. I think the group as a whole is very aware of our responsibilities as it relates to equity in today's environment. Next slide. So goal 3 of this group is to support and promote Be Well OC, the Result to Prevent area, Prevent and Act Early's older adult mental health training for professionals. So they're working with Be Well OC to foster mental health professionals panels through the support of older adult services, to promote older adult mental health trainings in the community, inviting first responders to be involved in trainings. As you can imagine, having our police force, our EMTs, as knowledgeable as possible about older adult mental health issues will make those interactions far better for everyone involved. And they provide content feedback for the training's translations. Another goal, reconnection with existing known friendly visitor programs and developing information about classic and emerging friendly visitor programs, refreshing an already created toolkit for those friendly visitor programs, particularly as it relates to the pandemic. We learned when we started reaching out, who's going into people's homes. Churches have volunteer programs, social groups do. There wasn't a compendium. There wasn't a place where they all came together. So the group created a bit of that. And in doing so, they created a toolkit for those who were perhaps not as robust, for those who were just starting, relying on the best practices for those groups that were quite robust and longstanding. There are quite a few friendly visitor programs in the county, run by everything from faith centers to nonprofits, and they're increasingly well utilized thanks in part to this good work. So they share that toolkit and they present friendly visitor programs to different organizations. Next slide. As Patty mentioned, data reports are a big part of what we do. So for 3 years, we've worked to compile whatever existing data in Orange County exists. So we go to some data from CalOptima, some data from OCTA, the Transit Authority, from other places where we can find stats and numbers on seniors. We learned really early on, there is not a lot of existing data for Orange County seniors. There's not a lot of fresh data specific to Orange County. There's some good statewide data, but to really drill down into what's happening in Orange County, we felt our reports were useful and not as useful as they could be. So this year, we're actually going to conduct our own survey of over 3,000 seniors, mirroring the demographics that we find in the last census. So in other words, the same ethnic breakdown, gender breakdown, those sorts of things. So we can get a really good sense on the pulse of what's happening for Orange County seniors in their minds. Now, let me be clear. This is distinctly different from the really great work that you'll hear about today with Advance OC and the OC Plan. They're doing some phenomenal work with surveys and town halls, and it's extremely robust. This is a very pointed survey to try and identify the things that our group is related to. We very much hope it will support Advance OC and that OC Plan. Next slide. So the Orange County Strategic Plan for Aging was a group we started in 2016 to really start a more concrete dialogue. It preceded the state plan's development about gaps in senior services and senior needs. And that's really where the work of the data reports started. We felt like to really do good work on strategic planning, we had to have some sense of what was happening. So most of that strategic planning work is now taken over by Katie Calvoda and her good group. But our group is still looking at some of that data. We blended this part of our organization into the main organization sometime last year to try and be a more effectively one voice. Our group does mirror the state master plan in its work. We try and align with the state goals. We look forward to further aligning with the county plan once it's created. And as I said, we're excited to see the county fund and Advance OC implement the county master plan. We think that's a remarkably good step for this county. We also think that the Orange County Aging Services Collaborative should be uniquely positioned to support the recommendations of the plan, and we really look forward to that, to providing that support. Next. Thank you. So in summary, I think that the Orange County Aging Services Collaborative, through its representative voice of all of our 40 members, I think that it's very important for us to make sure that not only are our senior voices heard, but that we're also listening to what's happening in our county and in our state. This is the first time in my 20 years in senior work in the county that I'm seeing this level of attention, this level of funding come into the senior space. So we definitely, as an organization, individually and collectively, want to capitalize on that attention. As you know, the only growing demographic in Orange County is 65 and older. Every other age group is declining. So we all know that's going to have a massive impact on caregiving. It's going to have an impact on housing and everything else. So the collaborative is looking very closely at how we can ensure we're there to support our seniors, and also that we're supporting them in the ways that they wish to be supported. Thank you.
Thank you so much, Jim. We so appreciate that perspective on the historical work that's been done and how we're looking toward the future. And to give us a perspective on the county work that's being done on the Master Plan for Aging, we welcome Claudia Harris, who is the Director of the County Office on Aging and Veteran Services. Those of us who've worked in aging services in Orange County really welcomed Claudia in 2022 into this new role coming to us from the Inland Empire. She joined the Orange County Office on Aging and Veteran Services after 16 years providing management of programs and operations of the Older Americans Act, locally administered by the designated area agencies on aging, Senior Information and Assistance Program, adult programs and APS, as well as in-home supportive services and the Clerical Administrative Support Unit. Additionally, Claudia has over 8 years of experience working for both the nonprofit and private sectors, providing direct services to older adults, adults with disabilities, and those experiencing mental health disorders. She is passionate for collaborative efforts and opportunities to expand upon the network of health and human services to maximize resources in local communities. She earned a bachelor's degree in psychology from UC Riverside and a master's in public administration from Cal State University, San Bernardino. And her career has been dedicated to health and human services projects. We welcome Claudia Harris. Thank you, Claudia.
Thank you, Patty. Thank you so much. Thank you for that lovely introduction. I have to say, I apologize. I am a little bit under the weather today, so I'm going to definitely try my best to keep my voice going for the duration of time. But I really want to start by saying the warmest thank you to Patty, to Jim, to all your team there at the Orange County Aging Service Collaborative for this invite, and to really have the opportunity to join such a passionate and dedicated group of professionals advocating on the needs of our older adults of Orange County. Now, it has been 2 years since the state of California released its first ever master plan on aging. And I believe we heard a lot of that information from Dr. Thompson. Thank you so much, Dr. Thompson, for your time and your commitment, as well as giving us that update at the state level. Now, this comprehensive framework that has been preparing the state for the growth of the 60 and older population to over 10 million people by 2030. And as she provided us an update today, it looks like by 2060, we're looking at another 400% increase. That's astronomical numbers, right, that we're talking about. Now, as our partners at California Department of Aging, the master plan for aging includes a 10-year blueprint for promoting that healthy aging that includes the 5 goals that she went over. And I want to just briefly talk about each of these goals. In terms of our efforts here at the county, our efforts with our community organizations and our county departments. The first goal, housing for all ages, stages and ages. And this goal provides really the focus on living where we choose as we age. And I am very positive that that is a very endeared goal for residents of Orange County. The second goal, health reimagined. It's providing the improvement to access to health services. Third goal is the inclusion of and equity, not isolation, really focusing on providing inclusive opportunities for older adults to live and to work without isolation and fear of abuse and or neglect. Fourth goal, caregiving networks. It's increasing and bolstering that caregiving workforce. As we know that, and we look at these projections of increasing population, with that will mean the increasing need for our care providers and some support systems. Affording aging, which is your goal number 5. This goal is focusing on increasing the economic security for aging Californians. But what does that mean? As the state creates this framework, and they have a slew of initiatives focused towards that development, the question we ask ourselves is, what does that look like? What does this framework look like for the over 600,000 older adult residents of Orange County? And let's keep in mind that, as Dr. Tompkins mentioned, that the U.S. Census projects this increase of older population by, in Orange County, over 25%, even just by 2030. So let's ask ourselves again, what does this look like for the Orange County residents? And what are we doing about that part? Where is Orange County and our partners? What have we done thus far in leading that way, in finding what our needs of our population looks like so that we can develop our own local framework? So in January, I'm very happy to announce that in January of 2023, just earlier this year, the Orange County Board of Supervisors, they commissioned an older adults needs assessment to determine the needs of the county's multicultural and diverse older communities. The assessment will serve to identify and really prioritize the needs and the factors affecting the health of our aging population, and to, most importantly, identify gaps in care and services. As part of the ongoing efforts to ensure that our county departments are meeting the goals and overall objectives of the assessment, the Orange County's Social Service Agency, Community Resources, the Office on Aging, Healthcare Agency, and our county's executive office jointly make recommendations for the completion of this comprehensive county-wide healthy aging assessment. As I mentioned, that information gathered and evaluated through this comprehensive assessment, it will help the county understand the holistic needs of the Orange County's aging population and provide our county departments with a better understanding of the areas of greatest needs, our current barriers, identify, the barriers to accessing services, and more precisely, as I mentioned earlier, really help us to identify gaps in services and any inequities creating these gaps. Now, additionally, the efforts will guide in the development of the local Orange County's master plan for aging, right? Why do we put all this effort in place? Why do we want to hear from our communities, from our older adults, from our community-based organizations and service providers and our caregivers? Because we are now here in Orange County at the forefront to obtain information and hear everyone's voice for the development of this local Orange County master plan for aging, and to in the future coordinate some efforts, some collaborations amongst our county departments, community-based partners, and stakeholders by providing complementary information to be able to reduce duplication of efforts, maximize our existing resources. As we know, there is an array of resources already available, but really tap into what is that looking like and what does that need to look like moving forth as we plan for our future. And the third really is to direct future programs and planning innovative initiatives. As the state has their framework in support of overall states, area agencies on aging and aging communities, we here locally look to also provide a framework with innovative programs and opportunities for additional funding and expansion of services, and even really look at the delivery of services and how services are delivered. So to achieve, and I want to say a great thank you to all our community partners, as I mentioned, but to achieve this goal, it takes a village. One agency, one county, we're not able to do this all alone. To achieve these efforts, contracted provider and partner Advance OC was selected to conduct the assessment. Patty, thank you for mentioning that earlier, and I know you'll have an opportunity to hear from Advance OC Executive Director, Ms. Katie Kalboda, on our current surveying status, how to participate in completing the survey, because we want to hear your voice. And, as I observe around the room and I look at the number of individuals that have joined us today, it is really, really exciting. Exciting because as you hear what is happening and where we are currently, where we're headed and what direction we're heading, it really is exciting because you here as a participant listening to the status and where we are, you're going to be a navigator, if I can say that, a navigator to spread the word, because we want to hear everyone's voice, especially those of our older adults and our caregivers. And on behalf of Orange County's Master Plan for Aging Planning Committee, our various agencies that come together to guide and support the efforts, I thank you for participating, for spreading that word to your family and friends, and to our caregivers. If you are a caregiver, and we also want to hear from you, your voice is very important. We can, through these efforts, really look forward to creating a new culture of caregiving that shapes, as a caring and supportive environment for our caregivers and older adults in need of care in Orange County. So I encourage you to make your voices heard. Patty, with that said, I will turn the floor back to you.
Great. Thank you so much, Claudia. And it's very exciting to hear what's happening and the progress we're making toward having a really wonderful plan for aging here in Orange County. Our next speaker is Katie Kalvoda, the president of Advance OC. Advance OC is now one of the nation's leaders in the new field of equity mapping. Advance OC has a mission to close social and health disparities in Orange County. They specialize in giving visibility to the marginalized and vulnerable communities by working on public and private initiatives that center on equity-oriented strategies. As a social entrepreneur, impact investor, and philanthropist, Katie catalyzes change, breaking down silos and bridging systems to pool data, dollars, and create action. She's the chief architect of the Orange County Equity Map, an award-winning data intelligence tool that accurately spotlights social and health disparities in neighborhoods across our county. She's regarded as a thought leader in the field of health equity, public policy, and data science. She's been interviewed by a number of national publications, including the Chronicle of Philanthropy, the Philadelphia Inquirer, and Governing Magazine. Along with her work at Advance OC, Katie is a board member of the Weingart Foundation, the Mission Hospital Foundation, the Sisters of St. Joseph Healthcare Foundation, where she serves on the Finance and Investment Committee, and leading strategies to optimize impact at each of these organizations. Katie's an appointed board member for the California Health Facilities Financing Authority, appointed by the Speaker of the California Assembly, to oversee publicly financed grants and loans to nonprofit hospitals and community clinics across our state. Her work on this board has allowed her to really have a bird's eye view of the challenges of equitable access to care across all 58 counties in California. She's on the front lines of issues ranging from healthcare workforce development to mental health. She studied at UC Berkeley and MIT in the fields of economics and artificial intelligence. So please welcome President of Advance OC, Katie Kalvoda.
Thank you so much. Always slightly embarrassing to hear about yourself in that way, but I'm so happy to be here. Thank you to our friends over at Alzheimer's Orange County for inviting us and including us in today's terrific event. I'm very pleased to be able to share with all of you the work that we are doing on behalf of the county's effort for developing a master plan for aging. And as I go through this, I welcome any and all outreach from our partners who are here on the call today and in the future, as this is an ongoing effort to be able to really truly develop a comprehensive assessment of older adult needs in Orange County. So with that, I'm going to share my screen and walk you through kind of what we've done so far and where we're headed. And if time allows, share a couple of collateral assets that our partners over at the Orange County Board of Supervisors has created in order to amplify the message about this very important community survey. Okay, so here we go. So what you're seeing on your screen right now is a presentation that we have done many times over for a variety of different audiences at different organizations across the county. This is just a little bit about us first before we begin. Advance OC is a nonprofit organization, so we exclusively serve the Orange County community. We have offices here in San Juan Capistrano, as well as our new office in Tustin. Our mission is to close social and health disparities in Orange County, and we do this using a very data-centric and equity-oriented approach. As Patty mentioned, we created the Orange County Equity Map using over 55 different indicators of the social progress index in communities at the neighborhood level. So we diagnose neighborhoods and all that ails us from a neighborhood standpoint. We also leverage data from a healthcare standpoint as well, using patient data, community data, school-based data, as well as all kinds of other social determinants. And we leverage this data and innovative technology. All of the advances in technology that you see in the private sector, we bring to our work in the nonprofit arena. And we do this by conducting intersectional analysis with our partners in the community to create data-driven and equity-oriented solutions. Some of the work that we have done in Orange County includes our partnership with Equity and OC, which is an initiative launched by the Orange County Healthcare Agency, conducting a population overview of 6 historically marginalized communities, one of which is older adults in Orange County. So we published that report for Orange County last year. And then we also do initiatives like OC Health Data, which is a data portal for Orange County, the healthcare agency, including information about all kinds of different topics, ranging from mental health to population demographics to building all kinds of dashboards to help increase public engagement with the healthcare agency. So those are kind of 2 of the projects that we are known for, and which is why we are thrilled to be able to help with this older adults assessment in creating the master plan for aging. Just to level set with everyone in terms of collecting data on Orange County's older adults, we're going to use the 2021 American Community Survey, which is from the U.S. Census Bureau. 2022 numbers just came out, but they have not been produced from all these various different indicators. So we're going to stick with this one for today. But you can see that in Orange County, we have roughly about 700,000 people who are 60 years and older, a slight higher number of females than males, typically speaking. And as we all know, the U.S. Census Bureau does not gather information on SOGI indicators, that's sexual orientation, gender identity indicators, so we cannot break that down further, but we hope to be able to do that specifically for the older adults needs assessment. Our median age for our 60-plus population here in Orange County is about 69 or 70 years old. So that's kind of where we stand with this population. And then you can see the breakdown of our racial and ethnic categories as well, both in the table as well as in the graph. And then if we look a little bit further, we can see additional information about our older adults that's available publicly right now through the U.S. Census. We know, just in context of everything, U.S. Census is not the end-all be-all in terms of data collection. They do a really good job and spend a lot of money being as accurate as possible, but we do know that there are historical biases, right? We know that there is an undercount, for example, of the Black and African American communities. We also know that there's an undercount for the Hispanic and Latino population. So we use these numbers as a benchmark, not as an absolute, right? So if we look at these numbers, we'll see roughly an estimate of family households by different types, and then the percentages of folks who are married, widowed, divorced, separated, and never married, as it pertains to both the total population of Orange County and then specifically for those who are 60 years and older. We also take a look at poverty status. And as we all know, California and Orange County has a very high cost of living. And so we're not just looking at the federal poverty level, which for all intents and purposes is a benchmarkable number, right, that we can compare against the federal or national levels. But for Orange County, we want to look at a slightly higher number than that, as depicting the vulnerable communities in Orange County, because we do have a higher cost of living. So that's why you see here the 100 to 149% of the poverty level, as well as at or above 150% poverty level as well. And then continuing on, not to kind of bore you into a data statistics class, and then these slides are available if you would like to have a copy for you to peruse later. But we capture veteran status, disability status, educational attainment of our population in general, as well as our 60 years and older population. We also heat map the population density of those who are 60 years and older. So these are absolute numbers in terms of total numbers and quantity of residents who are over 60 in Orange County. The highest population of 60 plus residents reside in the city of Anaheim. And that is about an 18% increase from 2015, followed by Huntington Beach, then Santa Ana, and then Irvine. You would expect that Anaheim, Santa Ana, and Irvine would have a high number of older adults because they are just large cities in general, right, for Orange County. And this chart doesn't take into consideration, cities like Laguna Woods and Seal Beach with Leisure World, where there's a high concentration of older adults. So I just wanted to make that point. But we do want to make sure that we understand where our populations live. So when we do outreach, that we can do very targeted outreach into the communities with greater precision, right? Another thing that we track, of course, is sort of the leading causes of death among older adults in Orange County. So as you can see here, this is data from the county, the Orange County Healthcare Agency. The number one leading cause of death in 2021 was heart disease for this population, followed by cancer. The all other causes is a little bit of a misleading number because it groups everything else in that bucket. But if you were to dissect this, in 2021, COVID was a huge indicator, but then also a rising number of death rates are coming from Alzheimer's as well, as you can see there. We track this information over time so we can see trends in terms of leading causes of death. And of course, we want to make sure that we disaggregate this data according to different age groups and also racial and ethnic categories as well. A note on psychological distress, which is how we are going to gauge, the mental health and behavioral health vulnerabilities of our older adults. There's data on psychological distress, and we're closely looking at the factors and indicators related to this index, and then capturing that information for those who are in Orange County. And then finally, I do want to speak to the fact that this is being hosted by Alzheimer's Orange County and the collective there. We do want to pay homage to the fact that there is a tremendously rising expectation of Alzheimer's and dementia impact in California, as well as across different counties, including Orange County, that the 3-year average number of Alzheimer's disease deaths are increasing and expected to increase even more. So what are we doing within the Orange County Older Adults Assessment? As Dr. Tompkins talked about, the California Master Plan for Aging, we are looking at their plan very closely and tying our work to those goals and different strategies. So as she mentioned, there are 5 pillars of that master plan for aging, which you see here on your screen, as well as the various strategies that are affiliated with those pillars. On the right-hand side of your screen, you'll see a flyer that has been distributed across the county, north cities in North County, as well as all the way down to San Clemente, and all over. You're going to be seeing lots more of this flyer appearing in the Orange County Register and all kinds of various different publications, including, let me just make a plug for the Answers magazine. We are on the back cover of that magazine as well, that's published by the Council on Aging. So you will be able to see a mass distribution of this flyer to make sure that everyone is aware of this initiative, as well as in ethnic media outlets as well, so that we get representation from every population group in Orange County. Furthermore, you will see a coordinated campaign that we're doing with the County of Orange. I have to say that they have been terrific partners in this, very willing to utilize every and all assets that they have in order to promote this needs assessment. So it's been a really great partnership with them. We, of course, have these postcards that we use to flyer at different events throughout the county in 5 different languages. We have them in English, Spanish, Vietnamese, Korean, Chinese, Farsi, and Arabic. And we also are able to proctor these surveys in those languages in person at these community events over the telephone. If you call our office, we will be able to proctor that survey in language to anyone that calls our number. It is also available online in these languages, as well as just being able to get it via the website as well, olderadultsurvey.com. So some of the things that we have been doing in partnership with the county is hosting these resource fairs so that the community understands that we have this very important initiative ongoing. And as you can see on your left-hand side, we kicked off this community survey part of the assessment on Labor Day. And so we started hosting these various different resource fairs with our Board of Supervisors. We have 100% participation rate from every single one of our Board of Supervisors hosting an event in their district. And so we have been able to access their offices and have their partnership in this. I have to say it's been really terrific seeing the amount of investment that they have put into this initiative. And then also collateral that they have put out, each of the offices have put out individually to also speak to this effort. And so with that, I'd like to just take a couple of minutes here and share with you some of the communication that we have seen from the Board of Supervisors. This first one I'm going to play is from Supervisor Doe, who is Vice Chairman of the Board of Supervisors, and he represents District 1. I hope you can hear this okay.
According to the 2020 census, there are approximately over 700,000 Orange County residents who are 60 years or older. By 2030, California's older adult population is expected to double. The County of Orange needs to hear from you on how its services and programs can help you better. The survey itself covers all the issues, whether it's healthcare, transportation, quality of life, food, and any other issues related to the seniors or to your family and your needs as well. And once these surveys are turned in, we'll have that submitted to the Board of Supervisors and the management of the county to do an assessment on the priorities and the needs of our seniors here in Orange County. There are many seniors who are recent or newcomers to our county who do not speak the language, who do not know where or how to access government service or even nonprofit services that can provide and help enhance their daily life or the quality of their lives. And that's why it's very important that we reach out to the very vulnerable or most needed community here in Orange County, which makes up a very large part of Orange County and its daily activities here.
So that is for District 1, and then I'd like to just share with you the video that's produced by District 2 Board of Supervisor Sarmiento.
Hi, I'm Vicente Sarmiento, Second District Supervisor for the County of Orange. We're just so happy to be here today at the Delhi Center, receiving information from our older adults here in Orange County, specifically in my District 2. This is the first of a series of town halls that we're having to come to our seniors where they are and ask them what gaps in services they see, what we can do better to deliver services to them. We've had a great turnout. We're expecting a lot of good information. People can access it online by phone. But more importantly, this is going to help us guide the next piece in our master plan for older adults that we're working on. So it's critically important to hear from the beneficiaries, the recipients of these services before we actually adopt any public policies. So it's great to meet people where they're at, to be here with them and to hear from them directly.
Okay, so so now we are going to go into the assessment a little bit and some of the parts of the assessment. We have developed a website here where anyone and everyone can access. It's olderadultsurvey.com. It will be redirected to our website that we manage. This is once again up, and it has two different surveys available to the community. One is the community survey. So if you are 55 years and older, you would take the community survey. And then we also have a caregiver survey. And the caregiver survey is for anyone of any age who is taking care of someone 55 years and older. And even though the master plan for aging is focusing on the population 60 years and older, we are taking the temperature of our residents who are 55 so that we can anticipate any needs of sort of like the approaching 60 years and older population. So we want to be as, again, thorough and comprehensive as possible, going above and beyond the 60-year threshold, but really including our population and residents who are 55 years as well. Just a little quick note on our team. We have a very large team dedicated to this project. This is what we do full time. I am the project manager for this assessment, and then we have a variety of very talented and well-experienced folks who are part of this project team, 2 PhDs, as well as a number of folks who have graduate degrees and very specific education in the field of public health, and also servicing and have direct services experience with older adults. Our project team, I'm proud to say, is also very racially and ethnically diverse. We have LGBTQ representation, and we span age groups from 20 all the way to 80 years old. So we do have members on our project team who span across all of these different age groups. It is very important to us that it is for the people, by the people. And so we have representation within our project team that covers this population. We have long-term residents of Orange County. We have lived here. I personally have lived here for over 30 years. We are first-generation immigrants. We are first-generation college students. We have mixed immigration status in our families. Our team members have also experienced homelessness. We've experienced poverty, and we live in cities throughout the county in the north, central, and south parts of the county. We have lived in public housing. We know what it's like to be on food stamps. We've been in the foster care system. We have IHSS experience, and we also have direct experience with assisted living facilities. We are refugees. We have different religious affiliations, and we live in monolingual communities. We are also caregivers for spouses, family, and community members ages 55 and older. And together, our team members are also native speakers of multiple languages. So we're able to offer that direct support of language access to the surveys as well as in our outreach. So with that, I wanted to share with you some of the key assessment instruments that we have launched and are launching right now. Many of you who are on this call have participated in stakeholder interviews or key informant interviews. This gives us sort of the landscape analysis for the older adults needs assessment, allowing us to understand what areas to zero in on, what areas to cover, what areas are missing, what areas are important to all of you. We conducted 80 different stakeholder interviews across multiple disciplines, across multiple sectors. So there was no stone unturned. Then we did a provider surveys of all providers of direct services to older adults. These are healthcare professionals as well as social services, as well as supportive services for older adults, including transportation and meal delivery. We are in the mix of our community survey right now. And so we're doing every single day, doing outreach into the community, especially in our hard to reach communities. And of course, those that have both social and linguistic barriers. Then we have focus groups. These are very specific and targeted focus groups in priority populations where we have identified that for one reason or another, that they have been left out or historically marginalized. So we want to make sure that we spend more time and attention into those priority populations. And of course, I just mentioned that we are doing resource fairs, not only sponsored by the Board of Supervisors, which have been really well received, but also resource fairs put on by our community partners. So all of you who have done events, community events, we have been there, we have tabled, we have basically given up all of our weekends to do these resource fairs until the end of the year. And it's very important for us to do that because that's how we reach people. And so we are there and are happy to be there. And if you have an event, please let us know. We would be more than happy to attend. On top of that, I want to talk a little bit about the focus groups and our priority populations. This is a partial list of them. And what I wanted to share with the community is that we are paying attention. We're paying attention to the people that you guys have identified as being community blind spots, right? So Advance OC and our county partners have identified priority populations that represent those historically underserved communities, those difficult to reach populations, or perceived community blind spots. So examples of historically underserved communities include our Black, our API, our Native and Indigenous communities, our Latinx communities that are undercounted by the U.S. Census. We want to make sure we have fair representation from that population, LGBTQ, Middle Eastern, North African, and our refugee population, right? Examples of our difficult to reach populations include non-hired or family caregivers, our older adults who are homeless or unhoused, our older adults who are incarcerated, our individuals with disabilities, homebound older adults, and residents with limited English proficiency. Then we have our perceived community blind spots. These are the groups that you guys have all told us in our conversations with you and other stakeholders to really pay attention to, because we have not done as good of a job as we would like to be able to give credence to their assessment. So we have near or recently retired older adults. Our upper class older adults, what are they doing about their aging plan that we can learn from or understand what the resources are that are available if money was not an object, right? How can we develop a better plan based on, sort of private sector offerings or folks that have found ways to achieve the optimal aging journey? We have veterans, older adult veterans who are very difficult to get to the table because of historical trust issues, right? And so we're doing very, very intentional outreach into our veteran older adult community. We have older adults with mixed immigration status that for, a variety of different reasons, once again, are hard to reach. And so we're working very diligently and hard to reach that population. Older adults experiencing mental health issues. Now, this is very difficult to do because, of course, if you do a survey or a focus group, you have to include surrogates or proxies if you have capacity issues, right? Mental capacity issues. So all of these issues and all these populations, we take very seriously, and we have an intentional plan that is purposeful. And I'm very grateful to the county for partnering with us and making these making assets and resources available to us so that we can reach these populations. Now, what does the timeline look like? So this is kind of what we have done so far. We launched the assessment in March of 2023, earlier this year. Then we kicked it off with stakeholder interviews. Again, we conducted 80 interviews over the course of 2 months. And then we did a provider survey. These are the hired professionals in healthcare as well as social services. Then we did small focus groups, our priority populations. We do them in language if there is a need. And we also also do them in places of trusted advisors. So we partner with community groups who are trusted partners in these populations. Then right now, you see that we are doing our community survey, our caregiver survey, and our community resource fairs. This is our boots on the ground outreach into the community. And we have people there who are proctoring surveys in person, helping them go through each of the questions and addressing any of the challenges that they may need, whether it's a disability or whether it's a language issue. We will then conduct additional focus groups of any issues that may arise from all of our different assessment instruments. And then we will create a final report that we will submit to the County Board of Supervisors in February. So this is what you can expect from us. I do want to just quickly go through all the various different modalities. So the key part of this assessment is being able to reach anybody and everybody so that everyone has an equal and equitable opportunity to participate. So we do this by offering it online through our website, which is translated into 7 different threshold languages. We have it in by QR code, but also a URL linked button that's available on different county websites as well. We have paper surveys as well, and we do quite a few of these surveys. We are going to send them out. Anyone can call our office and request a survey be mailed to them in the language of their choice. In addition, Advance OC will also do targeted direct mail campaigns in neighborhoods where we have not been able to have a high and robust response rate, right? And that they are harder to reach. So we will do a direct mail campaign. They can also pick up a survey at senior centers, at libraries, at faith centers. I mean, we're doing all kinds of different points of interest across the county. Once again, any provider can request surveys to be distributed to their clients by calling us, and we will make them available. We will even drop off the surveys at your place of business. We have done so also through meal delivery services, such as Meals on Wheels and Age Well. And I want to thank both of them for their collaboration on this effort, sending off our surveys in their meal delivery packages. And then, of course, at community events where we address issues with technology, where we address issues with vision or other physical challenges, as well as language barriers. And then, as I mentioned, our telephone surveys, incoming calls coming to us. We're actually going to be launching a dedicated Spanish-speaking line that will go directly to our team members who are Spanish-speaking. We feel we have a high need in terms of being able to address this community. And so the county and Advance OC is launching a very specific initiative to target our Spanish-speaking community residents. And so that phone number will be launched really very soon, along with a PSA initiative in Spanish. And then also outgoing calls. Advance OC will be making calls into households where we have not heard from or where there is a specific neighborhood need that are harder to reach. So all of these efforts comprise of our everyday, day-to-day, 9 a.m. to 9 p.m. effort here at Advance OC. We want to make sure that everyone, once again, has an equal and equitable opportunity to participate. So with that, I'll just wait for any questions from any of you during the town hall session. But once again, I give my gratitude to Patty and Jim and everyone over at the Collective and Alzheimer's Orange County for putting this together.
Thank you so much, Katie. That's really a lot of great information and gives us a really comprehensive understanding of what's going on in this data collection effort and really how extensive and deep it is. We appreciate that. This effort has been really a teamwork, really consummate teamwork, and spearheaded by Jocelyn Rubio, who is the Director of Collaborative Programs at Alzheimer's Orange County and oversees all the workings of the Orange County Aging Services Collaborative. With Amanda Avink and some of our intern staff, we have really enjoyed getting this put together for you today. We'll take a short break, approximately 10 minutes, and during that time, we want you to enjoy seeing messages concerning the Master Plan for Aging and the state of aging in Orange County from a number of our elected officials. Then we'll reconvene for the town hall Q&A portion of our event. So we'll be back live in about 10 minutes. Thank you.
Hi, Councilwoman Crystal Miles here from the city of Villa Park. I wanted to come on and let you all know about the Master Plan for Aging. Orange County is aging quickly. This is a great place to live and retire with plentiful resources for older adults, but we need to prepare for the coming growth in the future. In just a few decades, 25% of Orange County residents will be over 65 years of age. Our county is working collaboratively to prepare the local response to the California Master Plan for Aging. California's first ever Master Plan for Aging was a comprehensive framework to equip and prepare the state for the significant demographic changes that were about to occur. That was originally released in 2021. This Master Plan for Aging includes a 10-year blueprint for promoting healthy aging, including bold proposals for building housing for all ages, improving access to health services, providing inclusive opportunities for seniors to live and work without fear of abuse or neglect, bolstering the caregiving workforce, and increasing economic security for the aging Californian population. The Master Plan also applies the lessons learned from COVID-19. This highlighted the urgent need to embrace new ways of supporting older adults, people with disabilities, and diverse ethnic communities. California's senior population is becoming more ethnically diverse, more likely to be single or childless, live alone, work longer, and have lower incomes than decades past. The Master Plan for Aging outlines bold goals and strategies for leaderships in government, business, philanthropy, and community-based organizations to collaborate on creating age-friendly communities in Orange County. I congratulate the OC Aging Services Collaborative on their efforts to gather the Orange County community, spread the message of the Master Plan for Aging, and assist in crafting our local blueprint for the future of aging in Orange County in California. Fantastic job. Thank you for being a part of this very important and excellent event.
Hi, I'm Diane Dixon, Assembly Member from District 72 in Orange County. The cities I represent include Seal Beach, Huntington Beach, Newport Beach, Laguna Woods, Laguna Hills, Aliso Viejo, and Lake Forest. I'm proud to represent all of these cities. Orange County is aging quickly. This is a great place to live, work, and retire with resources and support for older adults that are plentiful. But we need to prepare for the coming growth of our aging population. In just a few short decades, 25% of the residents of Orange County will be over 65 years of age. California's senior population is becoming more ethnically diverse, more likely to be single or childless, live alone, work longer, and have lower incomes than in decades past. The Master Plan outlines bold goals and strategies for leaders in government, business, philanthropy, and community-based organizations to collaborate on creating age-friendly communities for all Californians. I congratulate the Orange County Aging Services Collaborative on their efforts to gather the Orange County community, spread the message of the Master Plan for Aging, and assist in crafting our local blueprint for the future of aging in Orange County. Thank you for being part of this excellent event, and I wish you good luck. Thank you very much.
Hi, I'm Orange County Supervisor Don Wagner. Orange County has an aging population. This is a great place to live and retire with plentiful resources and support for older adults, but we need to prepare for our growing number of seniors. In just a few decades, 25% of the residents of Orange County will be over 65 years of age, and I'm going to get there a lot sooner. Alzheimer's and dementia are serious issues for our aging population, as dementia is currently the third leading cause of death in Orange County, and over 164,000 of the 650,000 residents over age 65 are impacted by memory loss issues. Our county is working collaboratively to prepare for the local response to the California Master Plan for Aging. California's first ever master plan for aging, a comprehensive framework to equip and prepare the state for the significant demographic changes in the years ahead, was released in January 2021. This master plan for aging includes a 10-year blueprint for promoting healthy aging, including bold proposals for senior citizen housing, improving access to health services, providing employment opportunities for seniors, bolstering the caregiving workforce, and increasing economic security for our aging Californians. The master plan outlines bold goals and strategies for leaders in government, business, philanthropy, and community-based organizations to all collaborate on creating a range of care that caters to the needs of our seniors. I congratulate the OC Aging Services Collaborative on its effort to spread the message of the Master Plan for Aging and to assist in crafting our local blueprint for the future of aging right here in Orange County. Thank you for being part of this excellent event.
So thank you, and we so appreciate the participation of many of our elected officials. There are more messages that will be in our recorded version of this event, but we've had great participation and interest from just about all of our elected officials that serve Orange County. Next up, I'd like to introduce my colleague and friend, Jack Light. We'll go into the town hall portion of the event with Q&A. And as I mentioned earlier, many of you submitted questions earlier when you registered. So we have a list of questions, and we will do our best to get to all the questions that have been entered live during this broadcast. Jack Light is the director of the Family Caregiver Resource Center and St. Jude Brain Injury Network at Providence St. Jude Medical Center. He's a licensed clinical social worker, and his career as a clinician and administrator started in Orange County back in 1989. During his career, he's worked in public and private sector, always in social services, but also managed care. Since 2008, he's been working exclusively with family caregivers. He's worked on several research projects through UC Irvine, and he served as a part-time lecturer at Cal State Fullerton in the Department of Social Work. He supervises candidates for social work licensure and maintains a clinical private practice working with couples and families. Aside from his clinical license, he's also a licensed real estate broker, a man of all trades and lots of interests. Jack's a graduate of UC Berkeley, where he received both his graduate and undergraduate degrees. And Jack will be our moderator for this period where we are asking questions of our panelists. So welcome, Jack Light.
Thank you so much, Patty, for the introduction. And I just want to thank our panelists, Dr. Jackie Tompkins, Jim McAleer, Claudia Harris from the Office on Aging, and Katie Calvoda. Thank you for the presentations, and thank you again for answering some of these questions. And I'm going to start off with some of the questions that were provided to us earlier, and it's going to be kind of popcorn. If you feel like you can answer the question or have a comment, please do, and then we will just move on from question to question. So the first thing I wanted to discuss, because this came up a couple of times, was what is the plan for affordable housing for the aging who need assisted living and memory care services? And obviously, is there a plan to create affordable housing for these groups? And I guess the question is whether or not that's a focus of the master plan and how the master plan might approach that.
Jack?
Claudius, yes, go ahead.
And provide, and thank you for giving that little bit of information. We hope that through the information that we gathered through the older needs assessment from our older adults and caregivers, that it will give our county departments an opportunity to really evaluate what the needs are for various levels and various needs of our older, which include affordable housing. I'm pretty sure we're going to see a lot of that in this assessment, on top of additional services that we'll see, from caregiving to housing to transportation. There's some other things that we need on our day-to-day. We hope that with that evaluation and that analysis, we will be engaging with community partners, with our county departments, especially county departments and community partners that provide, let's say, housing opportunities, so that we can explore current housing. What does that currently look like? But also look at what an expansion will look like, what funding opportunities are out there, what can we tap into, so that we can look at that for always expanding need, right? As our aging population increases, therefore, I'm sure that the need for housing will also be at the top of that forefront, right? So we're hoping that it will open up these conversations so that we can develop and potentially then use that information to make that part of some of the initiatives for our local frameworks.
And this is Jackie Tompkins with the California Department of Aging. Related to the state's master plan for aging, I know that several of you are probably, focused in on Orange County's, plan for aging with it, which is fantastic. But I also want to elevate that within our master plan for aging, under our goal 1 strategy A, we have essentially 6 initiatives that are focused on increasing various housing options. And so just to highlight a few from our own master plan for aging, we're looking at exploring emerging local models to inform the consideration of rental subsidy programs for older adults and people with disabilities. And then also trying to identify and understand some of the barriers to producing accessory dwelling units, ADUs, and the opportunities for local, state, and federal action to continue the development of such opportunities. So again, there's about 6 initiatives, but just wanted to highlight, at least from the state level and some of our state level partners, where some of the housing areas of focus are.
Okay, thank you for that. I'm going to move on to, you also had comments that came in too from the community. So I just wanted to throw this out there too, while I remember the Senior Citizens Advisory Council, the County of Orange, is part of the California Senior Legislature, and they also write proposals to support the 5 pillars of the master plan. So there's a way for seniors to get involved through the California Senior Legislature, and that was put out there by somebody that responded to this forum. So thank you for that. The question that came in is, how is outreach being conducted for our seniors that are difficult to reach, those that do not have access to technology, and some in the community, including those that have language needs?
I can take that. So as I mentioned in my presentation, we're putting a lot of emphasis into outreach into those communities that are hard to reach and have difficulty with technology. We know that this is a particular population that has that faces that barrier, and so we're making ourselves available in person to conduct these paper surveys, so in-person proctored surveys, so that we can work with residents one-on-one, right, to take the survey. We also have telephone services as well in different languages that residents can call us, and we can walk them through the survey over the telephone. So lots of different ways in which we can make ourselves as accessible to this population, but also through our vast network of partners and collaborators on this initiative. They are also helping, and I want to spotlight them as well, because they're also helping their clients and patients take the survey as well, and sending them via mail to us. So we've gotten a bunch back from the community already, and some of our city partners also are jumping into the game as well. And so we're very, very proud of the countywide It Takes a Village effort that's being conducted right now to make sure that the survey is accessible and can be taken by folks that have all these challenges.
All right, thank you for that. And I just want to give a shout out here because somebody put into the put in a comment here that this is exciting, the Master Plan for Aging, as we are embarking on a senior services master plan for the city of Los Alamitos. So shout out to the city of Los Alamitos, way to go. So one of the things that maybe we haven't talked about, but that came up as a question here is more of a statement, but also probably a question, is OC must develop the affordable transportation systems for older adults. And I wanted to throw that out to the panel and see if anybody's gotten any comments or suggestions on how the master plan may be addressing that.
Well, I know that from a functional standpoint, our organization and a number of others works pretty closely with OCTA. Their senior transportation program, partly provided by Access, mirrors where bus routes are. So if a bus route's not there, Access doesn't get there. And the unfortunate thing is, those are the places where seniors tend to be the most disenfranchised, the most remote, and that sort of thing. So it just further compounds the problem. I think OCTA is doing their best work to try and get past that. But until we figure out how to not have that be the rule, we're going to have some folks who just do not have access to transportation for their needs.
And I'm going to add a little bit to that. Thank you, Jim. Through the OCTA, right, Access, which is the transportation accessibility for individuals with disabilities. I currently serve as part of the advisory committee for the Access piece and programming of OCTA, and I mean those services. And they really are, OCTA is moving forth with looking and exploring on expanding routes. They have been pretty robust in the last update during our advisory committee is that they have been robust in looking at their route systems and where they are. They've developed an opportunity where riders and or residents of Orange County can actually put in a request to have OCTA analyze and look at certain routes that maybe are just not readily available currently, but gives them an opportunity to put in a request for it and have OCTA look at the feasibility of adding new routes. They've expanded even some routes as we know, a lot of our older adults are also quite active and they also travel. Our older adults like to see, go see family and friends that might not be locally here in the area. And they've added routes as well to the John Wayne Airport. So that information is also available on their website. There are several locations in where the Access bus can go into the airports to provide that. And that's just an example I wanted to share here with the group. And thank you for the person that placed that question on the chat, that there are definitely some efforts of expansion. And, I had mentioned earlier what we hope that we receive with the evaluation and the analysis of the older needs assessment, that transportation is going to be one of those. And it will then be one of our tasks to look at what would that look like to engage our community partners, where our transportation gaps are, and give us some initiatives and frameworks to work towards that portion of it.
And if I may just add onto that, through our various interviews and focus groups and conversations with community members, there is quite a bit of innovation that's happening to address this need in the community. So, there's a service, I believe someone had mentioned in one of our focus groups, that's called GoGo Grandparent, which is kind of an Uber for seniors. And so they take particular care in serving the older adults population. This is not an advertisement for them. I personally have not used it, so don't take my word for it. But this is some of the innovation that's happening in transportation, as well as there are virtual villages. There are 2 virtual villages in Orange County, one in San Clemente, one in Laguna Beach, where the community members are connected virtually. If there is a need for transportation for a pickup or for, a ride somewhere, that they can ask community members who are part of their virtual village to be able to provide assistance. And so lots of creativity and ways that we can support one another as we age together and as we care for our aging family members.
And this is Jackie Tompkins, kind of related to the question about housing as well as transportation. Just want to highlight within our MPA state level stakeholders committee, the Disability Aging Community Living Advisory Committee. We are focused on housing and transportation, and there are actually 2 subcommittees of that larger committee that focus specifically on those issues. So again, members of the public can join those subcommittees, subject matter experts, those with lived experience, and connect with other partners across the state related to housing and transportation issues for older adults and people with disabilities.
Thank you for all those comments. And I did want to say that the comment did come in is to develop something like Uber for elders or something. So Katie, to your point, yes, you know, there are a lot of innovations out there. I'm just moving on to another topic. One of the questions brought in was somebody's interested in the linkage and integration to the state plan and funding resources and the inclusion of behavioral health. And I'm going to throw in there a question too about along the lines of also memory care services for our older adults. So I guess the question is looking at how the master plan on aging is going to address maybe older adult behavioral health issues, and then also memory care services.
You do have to look at the dementia care aware piece of the state master plan. We actually implement that in Orange County, and it's had some speed bumps in its startup. It's an excellent program, and I think as it matures, it's going to significantly impact care for people who experience some form of dementia or other forms of memory loss. It's basically where you go into physicians, clinicians, and you help educate and orient them on how best to serve our folks with memory loss. So I think that is a significant component of the plan.
And I'm going to add additionally to that, Jim, there are already, without even developing our framework through this assessment, there are some efforts being done by our county department partners over at Healthcare Agency, in which they have been recently awarded grants for Healthy Brain Initiative. With this initiative, it really focuses, which is also part of the MPA framework at the local level. The Healthy Brain Initiative is to really bring that awareness of Alzheimer's and related dementia within our communities and expanding that awareness to our older communities and their caregivers, engaging with community partners, developing advisory committee groups so that we can hear stakeholders' input in terms of what are those challenges. So I don't want to definitely speak more on behalf of our partners at Healthcare, our Orange County Healthcare Agency, but I can share that that's already in the works, and I'm sure more information to come as that brand new award and grant planning takes its course.
And on the topic of behavioral health, at least from the state level, this past spring, CDA did various roundtable listening sessions in 4 communities across the state. This included the Central Valley, Inland Empire, up in our rural Northern California, as well as the Bay Area. So we were able to get out into the community, hear from service providers, caregivers, people with disabilities, older adults about the importance of behavioral health. And as I shared in my presentation, our department was awarded $50 million to support older adults and elevate behavioral health issues. So look forward to working with communities to support that work.
Okay, thank you. All right, I wanted to this comment came in, and the question came in as trying to understand how the master plan may be able to consider the dietary needs when planning programs and facilities, special menus like halal and kosher, and obviously other things. I'll throw in vegan for those that may have that as part of their diet. Not mine, but just throw that out there. But are those things being taken into consideration in the master plan?
You know, we're seeing at the local level, and from the materials I've read at the state, Jack can speak better to it than I can, but we're seeing a great focus, a really new and strong focus on equity. And a lot of what you're talking about are things that relate to equity, faith-based diets, ethnically specific diets, and those sorts of things. They're hugely important to people's comfort in their homes. So I think it is actually really heartening to see such a strong focus on the state plan. And I know, and Katie can speak to this better, I know that's been a lot of the language I keep hearing coming from the Orange County plan. So I just think that's a really good sign that those things will be addressed.
Yeah, the only other thing I would add to it is we had a very good learning experience through COVID when there were vulnerabilities in our older adults of going out and grocery shopping and not having access to food and nutrition. There were lots of programs, creativity, folks like Meals on Wheels and Age Well and others creatively addressed the need for ethnic and culturally competent relevant foods and access to that. Although the sustainability of those programs is always something that is discussed, but the need was present and evident, and it was very much appreciated by the community. And I think that to Jim's point, that's something that we want to continue because it definitely added a lot of value and service to our older adult population.
I can add a little bit to that too, and I think I'm going to tag a team with Dr. Tompkins too in terms of some of those efforts to include culturally inclusive meals and planning for that through nutrition fundings through the Older Americans Act. There has been an effort and a push to look at opportunities within service providers and local providers of nutrition services to look at opportunities to include and be more inclusive of culturally sensitive meals as some of the funding through Modernizing Older Americans Act are coming down the pipeline. We are definitely looking at the local level here at opportunities to look towards that service modernization piece of it. So one is, Dr. Tompkins, is there anything you would like to add to that, or I'm going to put you on the spot?
No, that summarized it really well. It's really important when we look at some of the public services as it relates to nutrition are recipes that resonate with various cultures and backgrounds. And I know specifically when I was with the California Department of Public Health, I worked in the CalFresh SNAP-Ed program, and there were definitely conscious efforts to ensure that recipes were designed for populations of different cultures. So it's definitely something that resonates and is incredibly important as we look at food insecurity. So thank you.
Okay, great. You know, there was a question from an earlier presentation. I'm just going to get to this now. Is there were 3 counties that are implementing aspects of the master plan for aging. What 3 counties would those be? Were they on a slide?
Yeah, the 3 counties that are currently in the implementation stage, again, this data was collected around this time last year. So we actually might have a few more counties in California because that survey is out in the community again. So the 3 counties that are currently in the implementation stage of developing their own age and disability friendly plans includes Ventura, San Diego, and Los Angeles. So a lot of your neighbors in Southern California.
Okay,
So
thank you.
Definitely recommend peer-to-peer connections there, because again, as California is tapped to for from other states about the state level master plan for aging, there's so much great learnings that can happen when we have some peer-to-peer sharing at the local level.
Okay, I'm gonna ask a question here that came in, and one that I think is related to one that came in live is the issue of, and I'm just quoting here, elderly self-neglect, and maybe new programs to reduce cases. And one of our live attendees discussed this, asked a question about people unfortunately being found at home deceased several days after because of the lack of contact. But again, how's the master plan on aging going to be able to relate and address these concerns?
There's increased federal funding actually for what we term as live-alones, folks who experience some complicating issue of age, who live alone without a great deal of support. So a number of organizations like ours are beginning to tap into some of that federal, and there's some state funding as well, to stay in regular connection with folks who live alone and who have, again, some kind of complicating issues of age that make things more difficult for their daily living and that sort of thing. Specifically to the state plan, I'll leave that to Dr. Tompkins, but that is going on.
One area that we have supported and will continue to support is California's Friendship Line. And I'm happy to put some of these resources in the chat and for further distribution. But I encourage people to get connected with California's Friendship Line. That might be a wonderful resource as it relates to that question.
And I will go back very quickly to those visiting volunteer programs we talked about. There are, I believe, over 40 in the county, if not more. So there's a lot of peer-to-peer support and volunteer support that is available. You just have to get to organizations like ours to hook you up so you know where they are.
Thank you for that. Thank you for that. Okay. Question came out is, how will the lack of caregivers be addressed for the extensive numbers of baby boomers needing assistance? So I guess that would be, when we say caregivers, not only family, but those that may be paid, and obviously some of the other programs that help fund caregivers in the home.
Huge issue, right? As we talked about a little bit earlier with the escalation in aging, not just aging, younger folks are leaving the county in large numbers because of affordability. So there's a lot of moving parts to address the caregiver issue in the county. I really like some of the stuff that's coming out of the state on caregiver training. I think that actually is going to have a big impact. I'm hoping to see more connectivity, said with great respect to that program, with some of the local organizations doing the field work, because I think it's a stronger presentation. It's a stronger connectivity to actual on the ground caregiving. But it is a problem we as a county and we as a state are going to have to even put more resources on as our population ages. There just won't be enough people. There also won't be enough physicians, by the way.
Yeah, definitely related to caregiving. I shared in my presentation that one really hits home for me as a caregiver myself. We do know that the percentage and the availability of caregivers is limited, and will, as we see increases in the older adult population, people with disabilities, it's also an area of concern that we need to address, whether that's family caregivers or those who are paid. There are programs, as Jim alluded to, within our Department of Social Services through our in-home supportive services program, IHSS. So a lot of trainings being developed there. We have our own CalGrows program here at the California Department of Aging that's providing training for the direct care workforce. And there's a variety of initiatives within the Master Plan for Aging that's, overseen by our own department, healthcare services, social services, to address the need for caregivers. So it's definitely not an area that is not being addressed and recognized. It's something that is definitely elevated throughout the master plan.
Yeah, I want to thank everybody for those comments. Obviously, being the Caregiver Resource Center here in Orange County, the data from what we collect as an association, the statewide association of Caregiver Resource Centers, is that families are being asked to provide higher levels of complex medical care to their loved ones in their home. So this level of training is really important, and that's not just aging; it's for all across the board. So not only will family caregivers need that training, but paid caregivers, whether they come through IHSS or even through some of the registries around the state. But yes, the training is going to be very important, and not only that, just the volume of people available to do it. So yes, it is a big concern.
Jack, I see that Dr. Tompkins put the Friendship Line link into the webinar chat that I think only goes to host and panelists. So Jocelyn, perhaps you could figure out how to make sure that gets to everybody at some point. I think that's an excellent resource. And
Thank
Jack,
you.
I very much appreciate what you just said.
Well, if I can just remind everyone that we do have a caregiver survey specifically because we do want to emphasize this growing need, and that is separate. In terms of the older adults needs assessment, yes, we want to be able to understand the needs assessment of our older adults, but the caregiving component is also very, very important, associated with the older adults assessment, but also caregiving in general, right? So we have caregiving needs across multiple age groups, and we want to understand what the challenges and barriers are for caregivers. And so that's why it was important for us to be able to have both of these surveys taking place at the same time, because they are closely aligned, but also we want to understand what the caregiving culture is in Orange County, and have a separate conversation and investigation into those needs.
And if I could just give one other quick plug of types of activities that are happening. Nationally, there was a support family caregivers that was released. I'm thinking about 12 months ago. I could be a little bit wrong on the timeline, but from that, California is also developing a statewide caregivers equity roadmap to align with such strategy. And so some of our caregiver resource centers might be involved in that. So just want to highlight that again, definitely important issue that's elevated throughout the state's master plan for aging. So appreciate the questions that come in with regards to supporting the caregivers.
There are a couple of questions coming in on the chat, question and answer. One of them's might be a little bit technical, so correct me if I'm wrong here, but is the California Department of, I guess, Healthcare Services linked to DHCS peer certification, HCAI community worker, and health coaches? And I'm going to relate that to another question that's coming over in the community about getting more outreach workers to find and contact older adults and probably their families who are probably not well connected, and according to the question here, not my words, are attached to their couches and resistant to contact and getting out of their homes. So it's a mouthful, but
so one
I guess there are some
thing, of course, I love the collaborative, right? It's
right.
Going to the groups that already know these people. It's going to trusted sources. If you are the Semang Society of the Korean population, you are a trusted source, whereas I may not be. So if we really want to reach the hard to reach folks with services and information and connectivity, you go to the places where they might already be connected. Meals on Wheels is an excellent example of that. So I think I'm hoping that as the plan materializes, it relies heavily on the existing tentacles already in the community, because even if we're not touching a life, those our member organizations are closer to that life than someone who isn't embedded in the communities. The Promotores was another comment I saw in there that, are we working with the Promotores? The Promotores are an amazing resource in the Latino community, and absolutely, I think, should be included in implementation plans.
And I'm going to add a little piece to that and just kind of sharing some background information. I am aware through the Adult Protective Services Program, historically, the Adult Protective Service Program really geared towards those older adults age 65 and older. And federally, that age has dropped to include 60 and older. And really, one of the reasons and efforts or factors that attributed to that change is because we understand that at the age of 60, not necessarily 65 when it comes to like elder abuse and neglect, and at age 60 and older, we're seeing a great increase of that. So even at the federal level, these programs and age requirements, what constitute elder abuse and neglect, that includes self-neglect, right? Especially to those regarding the chat question. about those that are at the couches, those that are home alone, those are unfortunately having severe consequences because of being home alone and no one being able to check on them. That Adult Protective Service and what constitute an elder changed, and that age requirement dropped to 60 and older. With that then came some additional support in funding to that Adult Protective Service program that never before has that seen, or it had been decades that had occurred. And so I am sure our partners at Social Service Agency are quite busy with that expansion, with the reduction in age, and when they're seeing more adults, older adults age 60 and older, dealing with issues such as self-neglect and even neglect by others, and trying to address that. So just wanted to share that. That's an excellent question to kind of expand with that, Jim. Thank you.
Yeah, I also want to say that we are working very closely with organizations that have promotoras in the community to do outreach. I was just having this conversation with Dr. Bracho, as a matter of fact, from Latino Health Access. But so many other community health workers or like organizations that may not necessarily work in healthcare, but do have access to community members that are isolated, whether it's in a legal capacity, right, or having a trusted relationship for immigration, reasons, or other services in the community. It's very important to us that we use the infrastructure that is existing and those trusted relationships in the community, faith-based organizations being a key one, right, as well as other groups, so that the outreach is once again utilizing and tapping existing relationships, but that was also then just expanding what blind spots we have in the community. Who are those folks that are currently not being outreached as well? So that comment about those who are not leaving their homes, for example, we talked to a number of different mobile home coalitions, for example, and they are helping us go door to door and knocking on doors of their neighbors who they know are not, out and about or accessing resources, and so that they are aware of this survey as well. So lots to do and lots more we can do, but I'm just hopeful and thankful to all the organizations that have been a part of this.
Katie, I'm going to add a little bit to that too. Through all of these efforts to really try to get to not just our active, older adults engaged out in the communities, but those hard to reach, partners such as our service and nutrition partners that are out there delivering meals to homebound clients, bringing that information on how to get a hold of Advance OC to be able to do that survey over the phone. Or be able to do it themselves online if they're have the abilities for some technological. There have been efforts at the Office on Aging side to provide some iPads through some access to technology programs. So we have been putting some iPads into the hands of our older adults, especially those that are homebound, those that are a little more isolated and at higher risk, so that they can have access and learn how to take online classes to learn how to participate and do the surveying online, but most importantly, a phone number to a live person which they can get a hold of no matter what language need is. Additionally, through the Office on Aging's, the county's Senior Citizens Advisory Council members. They are our advisory council members, our eyes and ears out in the community as they engage with their local senior centers, their community centers, their organizations, their cities, municipalities, and their various groups, even on their own personal time that they engage with. They have been spreading the word to their friends, their neighbors, the centers, the senior centers, so that they know who to call, how they can call into to be able to participate and get their voices heard. So I definitely want to acknowledge that and provide that information here to this platform, because I had mentioned earlier, it really is taking a village. It takes the village to be able to address our needs of our ever-growing aging population. And I can tell you, I know as I age, because we have not yet found that fountain of youth. If anyone has, please let me know. But however, until then, and we continue together, as you can see here by the array of professionals at all levels, from the state to the local, to our community partners here, and to our stakeholders, to our individuals participating, and for all of these wonderful questions that are coming, to us. And it's showcasing that it really does take a whole village. So I just want to acknowledge all the boots on the ground out there, that we do want to hear the voices of our older adults and our caregivers.
Thank you. So I'm just canvassing. I'm going to circle back to some of the questions. Some of them maybe we may have answered, but I think they're worthwhile restating. So one goes back to behavioral health. If there is a plan to integrate mental health care and cognitive impairment under one program. So I guess as a clinician, I can say that there's a difference between somebody that has a mental health issue versus what we used to call organic brain impairment back in the day, something like dementia or Alzheimer's disease. Is there a plan to integrate that under one program?
I'll take that, Jack. I think we might be a little bit probably premature at this point, because we are in the thick of doing our surveying and seeing what we hear in terms of the needs and the interest, and identifying some gaps. Certainly, as I had mentioned, the goal will be to really look at if definitely mental health and or Alzheimer's, dementia related type of diseases and awareness is an issue, which we definitely, I'm thinking we will see that, right? That we will engage with our mental health partners, not just at the county levels, but our community partners levels, our healthcare providers, engaging in mental health services, and engaging in services to the cognitively impaired. And that does not include individuals with developmental disabilities as well, as we know that our individuals with developmental disabilities are aging, right? We all are. And there are some needs and services for the population as well. There's been a lot of effort and a lot of advocacy at the state level. Dr. Thompson, she might tap in. I'm going to put you on the spot again, but she might tap into some of the efforts through the Aging Disability Resource Connection, which really focuses on supporting a no wrong door system of network, where individuals of all ages experiencing all forms and shapes of disabilities, from physical to mental health to cognitive to just as we age, and in need of resources and connection to these programs and services. Those efforts continue at the state level for funding requests. And what does that look like here at the local level? Through the Office on Aging, we have our Aging Disability Resource Connection here we've had for a couple of years, and we are strong in making those connections with our community partners, providing services to an array of our population and their needs. So wanted to add that. Dr. Thompson, is there anything to add to that piece?
Nothing specifically. I just elevating how individuals with intellectual and developmental disabilities and the dementia in that space. I mentioned that we have the MPA Advisory Committee on Alzheimer's and related disorders. And I know that that is specifically one topic that is frequently elevated and concentrated on as well. I also know that within our Department of Developmental Services, they have positions that are dedicated to the connectivity between aging and those with developmental disabilities. The topic of mental health and developmental and cognitive disabilities are dispersed among various state agencies. So I think it takes something like the master plan, where we can all think about what is a targeted goal and strategy we want to work on. And again, not necessarily make new programs, but how can we make those programs more coordinated, more integrated, more person-centered? And so while there might not be again, like you indicated, Claudia, like too early to determine whether they should be under one program. I think there's some type of analysis that would need to take place related to that matter. But I think the key thing is knowing what programs we have out there. How are they serving similar populations? Are there opportunities to streamline and coordinate and integrate to, again, support the person more efficiently and in a more meaningful way? So yeah, definitely topics that happen at our state advisory committees as well. So if people are interested in particular topics, that's why I'm kind of highlighting some of the areas where I hear like, yes, we do talk about that, because if you are interested in learning more about what's happening at the state level from the various agencies and departments, absolutely, I encourage you to attend those meetings or even listen to the recordings. We're kind of done with our 2023 meetings. We just had the Alzheimer's one yesterday, but come 2024, there's going to be a lot of opportunities for panelists on this call, as well as the public, to attend those committee meetings.
Thank you for that, Dr. Tompkins, because that just brings up the idea that, you know, this is a process. Today's not the only day that you're going to get information. There's information out there. You know, Katie's group is doing their work. Jim and the OCASC is doing this work, and obviously the Office on Aging is working. So as we go into the last few minutes of our meeting here, I'm going to give, you know, there's a lot of comments. People are excited that this is happening. And a lot of comments are, hey, everybody's looking forward for the plan update. So in the next few minutes here, and then obviously I'm going to give Patty a chance to wrap things up, but I'd like to give the panelists a chance now to have any closing comments, and then I'll be kicking it back over to Patty Mouton, our host. So in no order of importance here, I'll let Katie go first. Fellow alum. There you go.
How nice of you. Thank you. Go Bears. Well, thank you all for coming and to this and being a part of this conversation. I just want to emphasize that we are one part of a big community of organizations who are uplifting our older adults here in Orange County. We are here as a vehicle to be able to share the needs of our older adults and be able to collect this information so that we can better serve them and all of you in your great work. So please come to us if you have a resource that you would like to offer to this initiative. It is a county initiative. It is not an Advance OC initiative. It is a county initiative. So all of this will come back to benefiting our county. Please reach out. I'll put my information in the chat for those of you who have special access or have different ways in which you can help us reach those hard to reach communities. I thank you again for listening and being supportive of this in advance. And once again, my hat off to this collective for their amazing work and continued advocacy for older adults.
Thank you for that. Dr. Tompkins, if you don't mind, I'll pass on to you.
I just absolutely want to thank the organizers for this meeting for involving the California Department of Aging. It's the last 4 weeks or so, myself as well as our director and deputy directors have visited a lot of communities. We've been to Tulare and Kings and up in Red Bluff, Central Valley, and it's always been a valuable experience to hear about what's happening at the local level. We definitely have the state plan, the strategic direction, but we also recognize that there are uniquenesses to each of our communities here in California. And I value and respect all of the work that this team is doing to collect data from a variety of sources, including the caregivers, and hear those diverse perspectives, because that's what's going to resonate for your own local master plan. I also want to highlight that as you start to build out your own master plan, please know again that there are a lot of supports and networks throughout California to help guide you in some of the areas that you're interested in, some of the resources, lessons learned. We at the state level have a local playbook for communities to take specific actions and recommendations and models and resources. So we're not reinventing the wheel, but really looking to be more efficient So I just want to again thank you and congratulate you, because this is a really big step, and I'm so excited to see what comes out of Orange County and look forward to partnering in the years to come.
Thank you so much. Claudia, if I can move on to you, I'll let you get a few words.
Thank you, Jack. I'm going to echo Dr. Tompkins and Katie for this huge endeavor, right? As I'd mentioned, it takes a village. It really is a big endeavor. And it really, I want to give also acknowledgement and kudos to our board of supervisors, our county executive office, all the county departments that are involved in trying to plan and steer, our partners, our community partners, such as yourselves here present, and all our stakeholders, because it does take all our voices from, as service providers ourselves in trying to develop our programs or try to unify some programs, leverage resources already existing. But it also is very important to hear from our stakeholders, our members that of the public that are accessing the services, and even for those that have not yet accessed the service or maybe hadn't had a need to access it. We want to hear from them as well as some of the things that they would like to consider, and as they embark upon a need to reach out for services and information. So everyone's voice is vitally important. It is, and I do hear great things of our local partners and local counties that are in this endeavor of developing their master plan. It does take quite some time. We have been almost 11 months. We're in November, so I'm going to say 11 months in the making of all the behind the scenes administrative tasks, right, to get to even to this point. Our partners, Jim and Patty, they're at our Aging Service Collaborative. Thank you so much for always being at the forefront and advocating on behalf of our older adults. Many clients that come to you, especially those that are experiencing challenges with maybe caring for someone or themselves experiencing Alzheimer's and or dementia related issues and concerns, always strong advocates in the community. So thank you very much for really hosting this forum and providing that platform. Jack, for moderating, thank you for this town hall Q&A session. As we also lean heavily on our Caregiver Resource Center and all the resources and support systems we have in place through our Older American Act funds to support our caregiver support program. And so it is a testament of probably a lot of still work to do as we find and look at and fine comb through our analysis to see what that roadmap is going to look like here for Orange County residents. So thank you so much for this opportunity. Please engage, please reach out. Lots of great information. Thank you, Jocelyn, for putting that in the chat for everyone to see on how to reach out to Advance OC via telephone and or online so that we can get your voices heard.
Thank you so much, Claudia. And before I give it to Jim, I'm just going to give a shout out to Jocelyn Rubio Melendrez and Amanda Evnick of OCASC and Alzheimer's OC. Thank you so much for the work behind the scenes. Jim?
Thank you, everybody. Claudia, Jackie, Katie, Jack, Patty, Jocelyn, Amanda. Truly appreciate it. This is the most coordinated effort I have seen in 20 years of working with seniors. Statewide, countywide, this is a remarkable effort. So if you're not involved in it in a relatively deep way to reach the seniors that you reach, you need to pick up the phone, you need to drop an email, you need to call Katie, you need to get involved. You also need to be on the next Zoom, the update, the town halls, the forums. We have a unique opportunity here to get out of some of our silos and play in the same sandbox, which will exponentially increase the quality of life for seniors in the county. So I just can't encourage you enough to plug and play with this initiative. It is the first time it has been coordinated on a scale this large, and it's remarkable. It is not the job of the County of Orange government or the state government by themselves to do any of this. They're the coordinators, they're the conveners. we're also a huge part of that puzzle. So pick your piece up and put it in the puzzle and stay involved. Your participation today is so much appreciated. Any of us are available by email for questions and comments and suggestions. Thank you.
Thank you so much, Jim. And just to echo a little bit of that, it's not just all of us that are here now. We probably know others, other agencies, other organizations that we can reach out to, because the solutions, I think it's been mentioned before, it takes a village. It'll take the whole state, it'll take the whole community of agencies, governmental and non-governmental in Orange County. So with that, thank you for the opportunity to moderate this discussion. Thank you again to the panelists. And then to our host, Patty, thank you.
Thank you, Jack. We really appreciate your expertise and moderation of our panelists and the Q&A town hall portion of this event. On behalf of the Orange County Aging Services Collaborative, the Orange County Office on Aging, the California Department of Aging, and Advance OC, we so appreciate you joining us today. You will be sent a link to the recording of this event if you registered and gave us your email, and the slides of the presenters will be available in PDF form, and those will be sent to you automatically as well. Again, if you have questions, we welcome you reaching out to us. Jocelyn Rubio can take your immediate questions and then send them out to whomever would be the best person to address your particular issues, comments, or questions. Thank you very much. Let's all go out and do everything we can to make life as great as possible for all of us, and of course, and especially for all of the older adults we serve. Have a great day. Thank you.